Anosmia or loss of sense of smell is a very important symptom that crops up in patients with COVID-19, and almost 50% of the patients with COVID-19 have suffered from it. A severe URTI, viral infection or rhinitis or sinusitis, tumors around the skull base affecting the olfactory nerves, even trauma to the skull have caused anosmia in the past. And since we are not as yet out of the woods as far as COVID goes, it becomes important for us to understand this anosmia as a symptom and how it affects us and how long it will bother us. I will start with the good news. It is self-limiting and you are almost certain to regain your sense of smell. The interesting question that arises because of this is, why does it happen in the first place? The good thing again about the COVID virus and your anosmia is it does not affect the olfactory or the nerves associated with the sense of smell directly. What it does is it affects the supporting cells, the cells which support these neurons, and they die. But thankfully, these supporting cells recover from the stem cells which are lying around. So that is how the symptoms crop up. When these supporting cells are lost, the patient becomes anosmic, and as they start regenerating again and again starts providing that vital support to your olfactory neurons, its function comes back. And usually it is around 3 to 4 weeks that the sense of smell comes back, but it's been observed that in some patients it lasts much longer. But eventually, by the end of 1 year, almost all the patients of COVID who had lost their sense of smell had come back. Another interesting facet about loss of smell would be the loss of taste which accompany it. And in many patients, there is no problem with the organ for taste, that is the tongue. The sense of smell by itself carries a lot of flavor of food along with it. And before you've even consumed the food, an idea about what it would taste like is already established in your head. So when you are going to taste a tasty biryani, the flavor that comes out of it kind of creates an imprint about the expected taste. Now, when that aspect goes missing with the loss of smell, obviously your taste suffers. And that is why most of these patients who've lost their sense of smell would present with loss of taste. But the other thing to note is, in COVID patients, there is indeed affliction of the tongue also, the epithelium of the tongue, and that could lead to some amount of loss of taste by itself. But usually, patients with loss of smell would present to us with loss of taste in the first place. Before I say goodbye, I can assure you, your taste is coming back. But remember, once you're back to normal, remember to eat healthy food and maintain a healthy lifestyle. Thank you.